Good afternoon, and please welcome with me to our networking corner Professor Kenneth Subotnik, Kenneth received his doctorate at UCLA, yay, go Bruins, and is currently an adjunct professor in the UCLA Department of Psychiatry and Biobehavioral Sciences. In his clinical training of doctoral students, he conducts research on aftercare programs and schizophrenia. And he is one of our outstanding mentors in our undergraduate research program. He's going to tell us about the path to graduate work, graduate studies in psychology. Kenneth?
Okay, yes, thank you. Yes, I'm in the, I received my clinical training at UCLA in the Department of Psychology, and now I'm a psychologist in the Department of Psychiatry at UCLA. And I thought, and in my work, I do a lot of mentoring of undergraduate students at UCLA. They come and join our research program, which is studying the early course of schizophrenia, which ironically affects people in the same age range as the students who are working at the aftercare program. So I know that one of the things that people want to do who are working at aftercare as an undergraduate is to go on to graduate work, either in the field of psychiatry or in psychology, or going on to medical school, and they want to get some research experience. And I think it's really valuable to get research experience as well as clinical experience. So I thought that today I would talk a little bit about um, how to get research experience and as part of the networking corner. So the research and clinical experiences will focus more on the research experience on the path to graduate school in psychology, but it's relevant also to medicine and psychiatry specialty. But so, in thinking about graduate school in psychology, because a lot of people are interested in that, one thing to consider is that a PhD or PsyD, a doctoral degree in clinical psychology, is really only one of the ways you can go. It's only one of the type of graduate programs that are available. And so, just to list out here, that there's a social work degree which involves counseling and psychological services. There's a master's degree in counseling. There's another degree called a marriage and family therapist. There's school counselors. There you can get a master's in general psychology. You can get a counseling degree, doctorate in non-clinical fields of psychology, and then there, of course, is psychiatry, which is a medical degree. So there's really multiple ways that fields you could go into. So we're not just talking about clinical psychology, although getting there is similar in terms of the experiences that you'll need. Right. So um, here are 7 tips for applying to a psychology PhD program. And again, it's relevant to all of those 9 types of programs. And this is from Dr. Kazdan, but the 2 of them I wanted to point out, he calls them wisdoms. Wisdom number 1, you will not get an interview without direct research experience. Okay. And wisdom number 5, you don't need 3 amazing letters of recommendation. You only need 1. You need one that's really, really amazing. You don't need all 3 to be really, really amazing. So what do? You need to cultivate a relationship with a great mentor and then show that mentor what you're capable of, what your capacity is. So how do you connect with a research mentor? Well, if you're at UCLA, and I'm sure many people listening are, then one of the best ways is to go to the research portal, and there's many listings. You get that if you're a UCLA student, it'll be through the My UCLA. Go to the undergraduate research portal, and then you can see there's a number of different uh, volunteer experiences, many of them for SRP credit, Student Research Program credit. And you click on one, and this is just one at random, which looks super interesting because this is a very hot field, transcranial magnetic stimulation and tobacco use disorder. So I would, I would think this would be very interesting to be involved in this kind of research. And so when you're picking a lab to participate, find one that's going to be interesting. That one seemed interesting to me. Find one that seems interesting to you. Now, if the work there seems like it's going to be very repetitive, see if there is going to be room to add responsibilities later so that it can become more interesting, but not just more interesting, so that you have more to say about what you did there later. Now, you want to remember, though, that you're picking a lab, not a career. Now, why am I saying that? Because this lab does not have to be the exact field that you plan to go into, right? You want to get involved in research, understand what it's like, demonstrate your capacity for doing research, and maybe even to present research like in the undergraduate research showcase at some point. It doesn't have to be spot on to what you want to do. In fact, it may help you to identify something that you like or don't particularly like. But you want to gain experience and you want to show what what you can do. Now, you will also want to be involved as much as allowable in the lab. So again, ask for higher level responsibilities if possible. If there are lab meetings, see if you can go to them. You can learn a lot from sitting in and listening to the discussion in lab meetings. Maybe you can even present something at a lab meeting. You can find out if an upper division SRP 199 is possible. That's a very good experience. And many of the students who are doing presenting their research this week in undergraduate research week, and today in particular at the showcase, have done SRP 199, the upper division uh, for letter grade. So see if the mentor would allow you to work some project up, take part of the data that that you're not necessarily going to be published, but could be presented here, and who knows, maybe you could present it also um, at a scientific meeting. You got an act and you can take it on the road. Maybe you can present it at the American Psychological Association or another conference, a virtual conference, or when they start having it live presentations again. And then you can, or perhaps you could do enough work so that you could be a co-author on a presentation. That's the kind of thing that would look really, really good on a graduate school application. But listen, it's not just all about research, although that's really, really important because a lot of people can have some good clinical experiences. But you know what? Here's the thing about getting a doctorate in psychology: you have to write a dissertation. Okay. And one thing that graduate schools do not want is someone who does not have the capacity to write a dissertation. So this is why this becomes a really crucial uh, criteria for deciding they'll allow into the graduate programs. But let's talk about clinical experience. So just on a very practical level, you want to find something that interests you and is close by. Inquire about whether you can volunteer there, assuming that it's paid employment is not possible. Now, you're unlikely to be doing clinical services where you're seeing patients, but you may be able to have some patient interaction. Like, for instance, you might be able to do some assessments, like in our program, you can do some questionnaires or even cognitive assessments with patients. One exception is that it is often possible for people with who are undergraduates to do behavioral treatment for autism because it's very one-on-one and takes a long time. So they often have undergraduates uh, do these behavioral treatments. So that's a way that you can get some direct experience. A lot of people do shadowing experiences, but they're getting harder and harder to find. And UCLA is frowning on it for undergraduates because of lots of HIPAA rules. And really, they're not as impressive on graduate school applications as it might seem. Uh, Unless it's supposed to be a summer internship or something like that, really you need to be in it for longer than a few months. I would say 1 year is a minimum because then you're going to establish the consistency and your reliability. And also, how is the person who later you're going to ask to write a letter of recommendation really going to know enough about you in order to write that really impressive letter of recommendation that you're going to want? So that's why you want to be around there and be as helpful as you can. So now I'm going to stop sharing and answer any questions coming through the chat room. Okay, so a little bit about me. Like I mentioned, I received, well, first, prior to going to graduate school, I was, um, I was a psychology major at UCLA, and I did an undergraduate honors thesis on biofeedback. See, this was not in the field I ended up going into. It was in biofeedback and in pain control with the late great David Shapiro here at UCLA in the psychiatry department. He was my undergraduate mentor, and he was one of those really fantastic undergraduate mentors, very kind, spent a lot of time with me. I learned a lot. I actually was able to run the polygraph and do the electrophysiology recording. It was great. After uh, my undergraduate work, I got a job in a inpatient facility, and then I was working with a lot of people with schizophrenia, and so gained some of that clinical experience. And then when I applied to graduate school, I had had both research and clinical experience under my belt, and entered UCLA and received my degree there. And I continued to work in schizophrenia in the Department of Psychiatry at the Aftercare Research Program with Keith Nectarline, who's also a clinical psychologist in the Department of Psychiatry. And I've been there. And then after graduate school, I stayed on and have been involved in that research. Let me see if there's anything else coming up here. So that's me in a nutshell summary. Um, I can tell you a little bit. Okay, let's see.
Kenneth, I had a question for you. Uh, if Are we live? Is this hot? Uh,
Yes.
what are some of the new emerging fields in psychology that are they evolving? Are there new territories to be thought about as to pursue for students?
hmm Well, let's see. So, in psychiatry, a lot of the very interesting research and newer research is about biomedical issues, pharmacological issues, what medications work best, but understanding what medications work best on a deeper level, sometimes by understanding um, the effects that the medications have on um, inflammatory variables in the human body, cytokines, and also the effect on symptoms that are not usually addressed by the medication, but might help the person to function better. So, not just relieving those symptoms. In psychology, there's a emphasis on evidence-based treatments. So people are looking for manualized treatments, treatments that can be easily taken from the university setting into the community and used in community settings, because oftentimes um, people who do not have easy access to treatment are the ones that are needing it the most, perhaps, but are not receiving it. So, creating treatments that are called portable, can be moved in the community, can be done at maybe a lower level of training, perhaps. Um, the things like that, looking at evidence-based treatments. Um, there's a question: how does your educational experience compare to what graduate students are experiencing today? Well, I think it's very similar, except that um, there's a much higher specificity in the types of labs and the types of research that are doing that people are doing. Very esoteric research. Um, so it's many many times we're moving from more um, surface level environmental factors to the electrophysiology, psychophysiology, genetic influences. And so, um, when you get into the genetic influences, very complicated, very specialized. And so I think that's one way that it's different. um, I think my educational experience, though, at least from what's being offered at UCLA, which is where I got my doctorate, is still similar. The other thing to think about is that there's differences in these programs depending on the research emphasis. Now, um, there's two psychology doctorate degrees. One is a PsyD and one is a PhD. And the PsyD will have a little bit less of a research emphasis. And when you get the degree, it's still considered to be a doctorate. But the level of involvement uh, throughout your education, graduate school experience is less. If you're going to have a doctorate, a PhD, you're more likely to be involved in a lab, and then that lab, you're doing research and it continues and culminates in a dissertation. In a PsyD program, you're less likely to be doing research throughout, but you still do the dissertation. But your dissertation may not involve collected data, it may involve literature review. Uh, or coming up with possibly a speculation of a new evidence-based method to be tested, but not actually testing it. Or it may be a survey, which would be easier to conduct, especially these days. You can do it on Qualtrics or other survey systems. So there are different types of doctorates, and you need to decide which is the one that is most interesting to you and which fits your career path. If you don't have an interest or desire to go further in research, then a PsyD might be better. Than a PhD. There would be less emphasis, and there'd be more emphasis on the clinical training, although both of them both types get a lot of clinical training. How do you anticipate today's climate will significantly impact resumes? Do you mean, well, it's hard. I would have to ask you if you mean the pandemic climate, the age of coronavirus. Um, I think it will impact resumes. It's going to be harder to get research experience. It's not impossible. At our program, we've transitioned completely to telepsychiatry and video conferencing, but the opportunities for the SRP students are less. Usually, at any given time, we have among our our undergraduates, our master's level trainees, our doctoral trainees, work study students. We may have 25 students or trainees at a given time, and so that's going to be less. So now in the new environment, so I think there will be fewer opportunities. It's going to be harder. Um, I'm not sure. There will still be some opportunities, but you can see at UCLA, all but the non-clinical research had been ramped down during the last few months during the coronavirus pandemic. So we'll have to see how quickly that gets ramped back up. But I do think there will be an impact in terms of opportunities. Um, Okay. What got me into researching schizophrenia? Well, that was that experience I had landing my first job at a inpatient facility and just being very fascinated by yeah, the whole disorder and getting to meet and spend a lot of time talking with people with schizophrenia and I found it both fascinating, enjoyable. I felt that I could connect with people who had schizophrenia, even some patients who had very little social contact, and I felt that it was helpful to them and got that feedback and then I moved on to a position at UCLA, which brought together my own experiences with psychophysiology because I had done research in psychophysiology, looking at heart rate and skin conductance and that kind of we were doing that kind of research at UCLA with patients with schizophrenia. So it brought together my interest in both topics and it was like a perfect choice for me. And that's how I got involved in the field. A kind of the combination of clinical interest and the research interest in psychophysiology.
Okay, Kenneth, I had one more question. What is the balance today, and how do you feel about it, the balance between pharmaceutical treatment and the good old one-on-one patient relationship? What's the balance these days?
Yeah, that is really good. I mean, there's never going to be a replacement for the one-on-one relationships with the clinicians. The having the an important relationship, and which the relationship with the clinician is so much different than just a relationship with a friend who's trying to cheer you up. It's a much more targeted approach. It helps to really uh, um, person will rise to the challenge, so to speak, of exploring themselves and then being able to understand why they're feeling a certain way, and then being given tools to change and improve their mood, reduce their anxiety. Even in schizophrenia, where the mainstay of the treatment is medication. Clearly, antipsychotic medication is indispensable for schizophrenia. However, that's just for starters. That's just to get the person to the point where they're not having active hallucinations and delusions, and they can start getting their life back together. And that takes trying to come to terms and understand what they had just gone through, which is a first episode of psychosis, and to try to get that into perspective, and then to get their life back together. If they were working or going to school and that was disrupted, and oftentimes because the age of onset is during the college years, a lot of times that's what got disrupted. So trying to get the person to get back to whatever is developmentally appropriate for them and what they're capable of achieving, even with the illness and the cognitive deficits that come with it. This is really important for the person's self-esteem. Working is very important for the person's self-esteem because the alternative to working is to being on disability, and then basically, um, you know, that's a sentence to a lifetime of demoralization, perhaps living in a board and care, and not really doing much but watching TV in the day room, and that's definitely what we want to avoid. And that is not just a medication fix. That involves a case manager, active community treatment, wraparound services, and so forth. So, um, that's just a good example of how the two are combined.
Okay. Thank you, Kenneth. Thank you for your time with us today. Thank you for the very valuable advice that you have given to our students and to our audience. And most of all, thank you for carrying on Dr. Shapiro's legacy of mentoring students to help them know who they are and what pathways they're going to take into their own lives in the future. Thank you, Kenneth.
Okay, you're welcome. Thank you for having me.